Eyelid pathology. Skin anatomy. The epidermis consists of 6 to 7 cell layers: keratinocytes or stratum corneum, granular cell layer or stratum granulosum, squamous cell layer or stratum spinosum, basal cell layer or stratum germinativum containing basal melanocytes. The epidermis also contains Langerhans cells, which are dendritic cells expressing class II antigen, basal melanocytes, which are neuroectodermal in origin from neural crest primordial cells, pluripotential primitive embryonic cells with ability to differentiate into epithelial cells. Meibomian gland, which is holocrine branching tubero-alveolar sebaceous gland with oily secretion located at the tarsus. Zeiss gland, holocrine sebaceous gland of cilia located at the eyelid margin. Moll gland, apocrine sweat gland with oily secretion, or ecrine sweat glands with thermoregulatory function, located at the eyelid margin, eyelash follicles, and the eyelid. Krauss gland, accessory lacrimal gland at the fornix. Wolfram gland, accessory lacrimal gland located at the upper margin of the tarsus. Congenital anomalies. Cryptophthalmos is failure of development of embryonic eyelid fold. There is partial or complete absence of eyebrow, eyelashes, eyelids, and conjunctiva, and there is replacement of conjunctiva, cornea, and eyelid with skin folds. Coloboma. Coloboma is an embryologic cleft with full thickness eyelid margin defect. It may occur as an isolated anomaly involving medial upper eyelid, or may be a part of golden hair syndrome, formed of multiple coloboma and other associations. Congenital ptosis. Congenital ptosis is drooping of upper eyelid as a result of levator muscle dysgenesis. Levator muscle fibers are replaced by fibrous or adipose tissue with poor function. It may be associated with poor development of superior rectus muscle, double elevator palsy. Congenital entropion is inward inversion of eyelid margin. It may occur as a result of lower eyelid retractors dysgenesis or structural defects in tarsal plate with short posterior lamella. Xerodermapigmentosa is deficient skin DNA repair following exposure to ultraviolet B rays. Xerodermapigmentosa is an autosomal recessive disorder. The skin shows diffuse erythema, scaling hyperpigmentation, atrophy, and telangiectasia. Xerodermapigmentosa carries higher incidence of squamous cell carcinoma, basal cell carcinoma, and malignant melanoma. Congenital lchthyosis is hereditary skin disorder characterized by hyperkeratosis and fibrosis. There are various patterns of inheritance of congenital lchthyosis. It may be inherited as an autosomal dominant, X-linked recessive, or autosomal recessive disorder. The skin is dry, with thick epidermis covered with thick, dense scaling. Various ocular changes occur in the autosomal recessive type of congenital lchthyosis: cicatricial entropion, papillary conjunctivitis with keratinization, and corneal changes including superficial punctate keratopathy and stromal opacities. Blepharophimosis. Blepharophimosis is short eyelid margins with narrow palpebral fissure horizontally due to lateral displacement of inner canthi. Blepharophimosis syndrome or Cohen-Romano syndrome is an autosomal dominant syndrome with a mutational defect in chromosome 3q and defective muscle differentiation. In blepharophimosis, there is severe ptosis, telecanthus or wide intercanthal distance, epicanthus inversus or skin fold extending from lower to upper eyelid, ectropion, and poorly developed nasal bridge. Other congenital eyelid anomalies include Epicanthus, which is a congenital semilunar skin fold bridging over inner canthus commonly seen in Asians. Epiblepharon, horizontal lid fold, stretching across the border of the eyelid and pressing the eyelashes against the globe. Distichiasis, accessory row of lashes arising from meibomian gland. Microblepharon, eyelid shortening resulting in incomplete eyelid closure. Ankyloblepharon, or partial eyelid fusion at the lateral canthus.